Hi, I'm Rick Pollack, President and CEO of the American Hospital Association. I'm pleased to announce the release of a very important report from the AHA Task Force on ensuring access to care in vulnerable communities. As you know from firsthand experience, many hospitals face challenges maintaining access to healthcare services in their communities. Rural hospitals may struggle with their remote location, workforce shortages, or a poor economy. And urban hospitals often face similar problems. As a result, many of these hospitals are fighting to survive, potentially putting communities at risk for losing their access to local healthcare services. That's why the AHA Board of Trustees created this task force, made up of 29 hospital and health system leaders and state hospital association executives from all around the country, to address the significant challenges faced by these vulnerable communities. This task force has done a terrific job in analyzing the situation, and we are grateful to each of them for lending their experience, expertise, and wisdom to finding solutions for this critical issue. Many thanks to Bob Henkel, President and CEO of Ascension Healthcare, who provided great leadership and chaired this task force. And now let me turn it over to him to tell us more about the report and the work of the task force.
Thanks, Rick. On behalf of the other task force members, it's my pleasure to tell you more about our work and recommendations. While we address a variety of issues in the report, we primarily focused on finding ways to maintain access to essential healthcare services, such as primary care, psychiatric and substance use treatment, and emergency and observation services in vulnerable rural and urban communities. Over the last 15 months, we developed 9 strategies that we believe will allow vulnerable communities to preserve this access. Each of these strategies encourages collaboration and will require hospitals to build and maintain strong links with community stakeholders to ensure that the healthcare needs of the community are met, now and in the future. While these strategies will not apply to or work for every community, our hope is that by presenting a wide range of options, we can help communities and the hospitals that serve them choose the best strategy or strategies based on their individual needs, support structures, and preference. In addition to these strategies, we have highlighted communities and AHA member hospitals and health systems around the country that have adopted some of these models. We believe their early successes will serve as inspiration for other communities as they begin to adopt these new strategies. Throughout the report, we also identify barriers that may limit or impede implementation of these strategies. We believe this list of barriers naturally leads to the development of a public policy advocacy agenda for the AHA. We also believe that vulnerable communities will need resources to help them successfully adopt one or more of these strategies, and we have identified some operational tools that will help hospitals on this journey.
Thanks again, Bob, for your outstanding leadership of this task force. The menu of options presented will help preserve access to healthcare services in vulnerable communities. And this report is designed to provide a pathway to ensure that every hospital in America, regardless of how you redefine the H, has an opportunity to be an access point or anchor of service in the communities they serve. We expect that this report will have even broader applications. Now, it's critical to know that this report is only the first step. Not only do we hope it will be a useful tool for learning about innovative approaches taken by your colleagues, it also provides policy recommendations that we will be advocating with the new president as well as the new Congress. As Bob indicated, we will need to align in new ways, form new and different relationships resulting in valuable partnerships, and promote successful strategies. We look forward to working with each of you as we continue to transform our delivery system to advance health in America. Thank you for listening, and thank you for all you do for the patients and communities you serve.